Hello, and thank you for joining us. Our webinar will be beginning shortly. I'm just going to take a moment for everybody to get into the room and get settled, and I will begin in just a moment. Hello and welcome. I will be beginning this webinar shortly. Hello, everyone, and welcome to this webinar. Today's webinar is Jet Fuel in the Drinking Water in Hawaii, an environmental health catastrophe presented by Dr. Diana Felton. A few housekeeping items first. You will be muted during this presentation. If you would like to ask a question, please enter it into the online Q&A box, not the chat box, but the online Q&A box. We will save time at the end of this presentation to address as many questions as possible. This presentation is being recorded and will be made available on the Center for Occupational Health YouTube page and on our website. All participants who logged in with a registration email for the full live presentation today will receive an email tomorrow with a link to an evaluation form that will qualify participants for a certificate of completion worth 1 continuing education contact hour. Once the evaluation is complete, you'll be able to access and print your certificate. At this time, we're pleased to welcome our presenter, Dr. Diana Felton. Dr. Felton is the state toxicologist for the Hawaii Department of Health. She graduated from the University of California, Berkeley, and attended medical school at the University of California, Davis. Emergency medicine residency was done at Beth Israel Deaconess Medical Center in Boston, Massachusetts, and a toxicology fellowship at the Harvard Medical Toxicology Program. She spent many years as an ER physician and toxicologist in Massachusetts and Hawaii before transitioning to state government work in 2018. Welcome, Diana. We're so glad to have you.
Thanks so much for having me, Jessica. Can you hear me okay and see the slides all right?
We can, thank you.
Okay, great. Thanks, everyone. I'm really pleased to be here. My name's Diana Felton. I'm the state toxicologist with the Hawaii Department of Health, and I'm pleased to be presenting to you today the story of this event that we've been dealing with in Hawaii now for over 14 months. Before we start, I do want to just point out that, why we're going to be talking a lot of details today, medicine and emergency response and epidemiology. This event was really impactful and harmful to a lot of individuals. And I always just like to acknowledge that before talking about it in a somewhat technical and clinical way. So we'll get started. Also, as a note, I know a lot of these webinars tend to be occupationally focused. Today is really more of the EH part of COEH. So I hope it'll be interesting to everyone, and I look forward to answering questions at the end, and also I'm happy to share my slides at the end as well. So here is an outline of what we're going to be talking about today. We're gonna, this is a really large topic, and it would take hours to go through all of the details. So today I'm really going to focus on the aspects that are, I hope, most of interest to this group, with some information on the background of the facility and the details of the release of JP5 jet fuel into the drinking water system that occurred in November of 2021. We're going to talk about the emergency response, and then we're going to spend a fair bit of time talking about the current knowledge and the further evaluation of health effects from this event, and also the difficulty in predicting the long-term health impacts. And then, of course, what's next, both for the facility and the environment and the people affected. As with all presentations like this, we have some learning objectives. So these are the ones that we're going to go through today, very similar to the outline. Hopefully, we'll fill in the gaps as we go. So just for some context here, I always like to show this map that shows how far away Hawaii is from the mainland. For example, I can get to Japan faster than I can get to Denver. Here is a map of our state, and we're going to be focusing on the island of Oahu up here, which is where about 85% of the state's 1.3 million residents live. So Honolulu area. And this is a closer up map of the island. Famous Waikiki Beach is down along this area with Diamond Head in this bottom right area. And we're going to be focusing on the area in orange and yellow in the middle here, which is the area affected by this water contamination, the Joint-Base Pearl Harbor Hickam water distribution system. This is a regulated public water system operated by the US Navy and serves an estimated 93,000 people. This next map was actually created by CDC's Agencies for Toxic Substance and Disease Registry, or ATSDR, and it in purple shows the housing communities that are served by the Joint-Base Pearl Harbor Hickam water system, an estimated 9,600 households. Other areas served by the water system are industrial and workspaces on the base. And now I want to draw your attention to this upper right area here where it says Red Hill Underground Fuel Storage Facility. And also just for context, I should have mentioned this before, but this is Pearl Harbor with its 3 different arms. And of course, the history of Pearl Harbor from the 1940s all took place in this area. So now we're going to focus on this area, the Red Hill Underground Fuel Storage Facility. So the Red Hill Bulk Fuel Storage Facility contains the Pacific Strategic Fuel Reserve. It's somewhat of an engineering marvel built in the 1940s, and it was actually kept secret until the 1990s. It was not known about nor bombed on December 7th, 1941. The facility sits 2.5 miles Mauka, or uphill of Pearl Harbor, and it's connected by a tunnel with pipelines as seen in the lower picture on here. So this tunnel runs from the base and the airfield down at sea level, 2.5 miles uphill to the underground storage facility. There's 20 tanks, and each tank is 100 feet in diameter and 250 feet tall. And each tank holds about 12.5 million gallons of fuel. They're arranged like the upper picture here in 2 lines with 10 on each side, and the tunnel and walkway up with the pipelines through the middle. And all of the tanks are completely underground. The top of each tank is 100 feet below the surface. And then the primary drinking water aquifer is just 100 feet below the tanks at the lowest location. So the access to the drinking water source in this area which is called the Red Hill Shaft or the Red Hill Well, is less than half mile from the bottom of the tanks and is in this area over here. And there's been a history of spills from this aging infrastructure with at least 3 reported releases in 2021 alone. So I really want to emphasize the enormity of this facility and each of the tanks. It's really quite something, and I was unable to grasp it really until I was able to go there and do a site visit. But this first picture is from the construction of the facility in the 40s and shows some of the miners. So you can start to get a little perspective of sort of the enormity of each of these tanks. And remember, there's 20 of them. This picture shows Aloha Tower. Aloha Tower was built in 1926 and is down on the waterfront in downtown Honolulu. It's often considered the Ellis Island of Hawaii. And it's 10 stories tall. And Aloha Tower could fit inside each of the tanks. So a 10-story building can go inside each one of those tanks. So it's really these massive, massive structures and huge amounts of fuel being stored. This is a recent historical timeline that shows some significant dates from the history of this event. Starting in 2014, when there was a large release of petroleum products at the facility from Tank 5. And thereafter, the Hawaii Department of Health, the EPA, and the US Navy entered into what's called the AOC, or the Administrative Order on Consent, to manage the oversight of the facility by all 3 agencies. Then there were multiple more spills both on the ground at the facility and to the surface water down at Pearl Harbor from 2020 and 2021. And of big significance is this spill on May 6, 2021, and then also November 20th, 2021. So how did we begin to identify the problem that occurred in November of 2021? On November 28th, the Sunday after Thanksgiving of 2021, just a year plus ago, the Hawaii Department of Health and the Hawaii Poison Center began to receive calls from residents of fuel-like odors in their drinking water and health complaints. The Department of Health received hundreds of calls in the first 2 days, and the Hawaii Poison Center received 30 calls. Initially, we had some suspicions about the contaminant, but there were many unknowns. We didn't know exactly what the contaminant was. There were questions of possible terrorism, other agents, PFAS, and a wider spread than just the Navy's drinking water system. Due to all this uncertainty, we elected to issue a conservative health advisory telling all people on the water system to not drink the water. This got some initial pushback from the Navy, who early on thought the problem was limited to just certain neighborhoods. Fortunately, we did receive notification that the Navy had disconnected the Red Hill shaft from the water system on the night of November 28th and began immediately supplying the water system with water from a different water source many miles away. So that was a good action that occurred quite quickly, as they shut off the contaminated water source very early on. The Navy was initially very certain that the contaminant was JP5 jet fuel. It took us at the Department of Health some time to be confident that that was also the main contaminant. This map shows a heat map of the first 10 days of the incident and the complaint calls that we received. And mapping like this really helped us recognize that the problems were confined to this single public water system and didn't have broader implications at this time. So again, the day after the complaints started, we issued the Do Not Drink Health Advisory. It's something we're quite proud of, taking aggressive conservative action early on in the face of a lot of uncertainty. So I did want to spend a few moments talking about giving a description of the complex chain of events that occurred that led to this disaster. So on May 6, 2021, a surge in the system caused a pipeline break, which released many gallons of fuel into this tunnel higher up near some of the tanks near the top of the tank farm. Much of it was cleaned up, but some portion of the spilled fuel ended up in an unused fire suppression line. That's one of these PVC pipes you can see here at the top of this picture. And that was a fire suppression line, reportedly unused, filled with water, but a whole bunch of the fuel that spilled on May 6th got into that line and no one knew that it was there. So it was unbeknownst to anyone. Then it's the fuel and the water mixture sat in that fire suppression line until November 20th, when a people mover in the tunnel hit a valve on that PVC pipe from that fire suppression line, and the mix of fuel and water in it spilled into the tunnel. It spilled into the tunnel and then actually collected in a sump or a gathering area underneath the tunnel that also nobody knew was there. And the sump was designed to collect groundwater from underneath the tunnel to prevent flooding and seepage into the tunnel. So it had a French drain leading to it to drain groundwater into the sump. But as the fuel and water mixture built up in the sump, it actually backed up the French drain, and that led directly into the area of the Red Hill shaft, or the drinking water source. So as the fuel and the water accumulated in the sump, it backed up the French drain and then drained right into the drinking water source. And the Red Hill shaft, the drinking water source, when evaluated, actually had multiple inches of free fuel product on top of it when the contamination occurred. But the fact that no one was even aware that this sump or the French drain existed really highlights one of the challenges of safe operation of this facility. And of course, for those of you who are interested in PFAS chemicals who might have perked up at the fire suppression line, comment, this was also of major concern to us that there might have been aqueous film forming foam or AFFF in that line, but it fortunately had not been used, and multiple sampling of both the shaft and taps from the system did not reveal any PFAS detected early on. So that was able to be taken off the table fairly quickly. So just again, a picture of the tank farm and the location, and this area down at the bottom where the drinking water source was contaminated. So now you've heard the background on the facility and the event, we can talk a little bit about the medicine and the health part. So here we are with an unprecedented event. There's no historical or experimental model of this type of exposure. It's basically short to medium term exposure to JP5 jet fuel and drinking water. So how do we assess immediate health impacts? And then how do we predict long-term health impacts when there's no baseline scientific, very little baseline scientific information to go on? So first we need to know more about JP5, the primary contaminant. JP5 is a military grade jet fuel. It's considered kerosene-like, but it's not identical to kerosene. It's made up of over 1,000 different constituent hydrocarbons, with each batch being slightly different depending on the refinery. The main constituents and their estimated concentrations in a pure fuel mixture is listed here. But remember that people were exposed to this fuel mixed with water. Fortunately, some of the nastier components often in fuel, such as benzene and toluene, are in very low concentrations. And in fact, were not detected in any of the thousands of water samples that were taken both from the Red Hill Shaft drinking water source and the taps from the homes and businesses on the water system. Xylenes, methylnaphthalenes, and naphthalene were also not detected significantly in any of the point of use samples. And this is likely because they evaporated off fairly quickly. So the different size hydrocarbons making up the bulk of the JP5, the bottom 4 constituents listed here, are tested for in water as total petroleum hydrocarbons, or TPH. So where can we get information about expected symptoms from exposure to JP5 in drinking water? The short answer is there really isn't very much specific information. So we have to extrapolate from similar compounds and use principles of toxicology and physiology to make our best deduction. So we looked at review articles about hydrocarbon toxicity, such as this one from Clinical Toxicology. We looked at ATSDR's toxicologic profiles of JP5, JP8, and jet fuel A that summarize the available data on the subject, of which there's not really a lot. And in particular, all of the scant human studies that have been conducted on JP5 have been occupational, and mostly dermal and inhalational exposures. The animal studies have had some dermal exposures, but there were almost no studies on oral route of exposures. So for some examples, the military had this one report in military medicine about dermal exposures, usually young Navy flight techs filling planes with this fuel and then splashing some on their skin. Was a little bit from the, let's see, this one was from the National Research Council on inhalational exposures, and the National Tox Program looked at dermal exposures in mice in the 1980s. That's pretty much it. Really isn't anything that models the type of exposure that happened to these individuals and experienced by people in this event. So another major difficulty in understanding what kind of health impacts people have is we really have no information on how much JP5 people got exposed to, particularly on an individual basis. And this is probably the single most limiting factor in assessing the health risk from this incident. By the time any water samples were taken, much of the contamination had already been flushed through the system and diluted. The water samples all had pretty low concentrations of total petroleum hydrocarbons, but we know people were exposed to higher concentrations than what we were able to detect in the samples, especially in the early parts of the incident. But how high was it? And it was, given the age of the water system infrastructure and just the physics of the water system, it's really unlikely that it was a universal exposure. So predicting an individual's exposure at this point is basically impossible. And this has made it very difficult to understand what health symptoms are related to the contamination, and even more challenging to predict long-term health impacts. So the symptoms listed here are sort of what we would expect from symptoms of it from exposure to petroleum hydrocarbons in drinking water. And indeed, these are the majority of the type of symptoms that were reported at the beginning and throughout the episode. It was mostly consistent on what we expected. And fortunately, we didn't see significant cases of hydrocarbon pneumonitis, the severe respiratory illness that can occur with ingestion of high volatility, low viscosity hydrocarbons like lamp oil or lighter fluid. So that was a good thing, that people were not getting really severe respiratory injury from exposure to these chemicals in an inhalational setting. Risk communication immediately right off the bat became a huge need. Our Department of Health communications officer of 30 years retired the day after the event occurred. So the new person was thrown into the fire. Early on, it became really clear that inconsistent and confusing messaging was adding to the community's distrust and frustration. And one big mistake that was made by the Navy right away was that the base commander reported the first day that everything was fine with the water. We're all drinking it here on base. And that was clearly premature and without all the facts, and ended up being very wrong. And so it immediately lost trust and credibility. And for a few days after that, the Navy continued to believe and message that only certain neighborhoods were affected and that others didn't make precautions. But that also proved to be false and was in direct conflict with the Department of Health's kind of more conservative messaging. To make matters more complicated, the water system serves an area of housing that's all Army personnel and was greatly affected by this incident. And the Army took a more conservative approach that conflicted with the Navy's initial guidance. And so really all the different voices would really enhance the confusion and the frustration in the community. So, we really did our best to get the message out effectively and consistently, but we definitely could have done better. I think hindsight is always 2020, but if we had realized the scope of the event right away, I think it would have really helped to bring in a bunch of PR contractors right away that could have improved our messaging and just increased the volume of our messaging as well. But of course, it's hard in the moment to realize the scope of the problem. So, we targeted the public via news releases and TV appearances and fact sheets and websites and social media. We put out guidance for healthcare providers taking care of patients who were seeing people who had been poisoned by the jet fuel. And, we made strong efforts, but I think this is an area we could have improved. One of the most effective aspects of the overall response was the assistance we received from state, local, and federal groups and the partnerships that formed as a result. This is an incomplete list here, but every group on this list contributed in major ways to the response. Special shout outs are reserved to the EPA Region 9 staff that assisted. Many folks from their water emergency team and their on-scene coordinators and their communications teams came out from California and spent weeks and months working on this almost around the clock. Also, special thanks are due to CDC's ATSDR and National Center for Environmental Health. We asked them for technical assistance early on, and they responded with a large team of experts, which I'll talk about a little bit more in a bit. But I can't underestimate the value that all the partners brought to the table and all the different aspects that were needed to complete this response, both the emergency response and the ongoing work that continues today. So now you have a sense of the background and some of the health impacts. This is a little bit more about the spill, and I'll run through some of these key time points and some of the effects that happened. So again, the spill on November 20th, the first health complaints on November 28th, November 29th, the health advisory to do not drink the water. On December 6th, the Department of Health issued an emergency order to immediately suspend operations and defuel the Red Hill fuel storage tanks. This was initially appealed, and a lot of time and energy was spent in the litigation process or the courtroom process trying to keep the emergency order standing and force the defueling of the facility. On December 17th, an agreement was made between the key agencies, the Department of Health, the Navy, the Army, and the EPA to enter into the Interagency Drinking Water Systems Team, which would begin the months of work to test and clean and flush the water system and hopefully return the water to safe drinking as soon as possible. On March 7th, the Defense Secretary issued a memorandum announcing that they would permanently close the Red Hill bulk fuel storage facility and begin to outline the plans for making that happen. And then March 18th, 2022, more than 3 months after the incident, the last of the neighborhoods on the drinking water system was declared safe to drink. And long-term drinking water monitoring continues now and will continue for more than another year. So a little about the Interagency Drinking Water System Team. Again, this is the group that was put together to clean, flush, and test the drinking water system to restore drinkability. As you can see, the goals here. And responding to an environmental and public health crisis of this magnitude really required working together. And this partnership was really important. It was really an attempt at a joint leadership of the response. And the team was ultimately very effective. I wish I could report it was completely all smooth sailing and roses and universal agreement, but that's not necessarily the case. There were some serious power and resource discrepancies, fair bit of disagreement and conflict and varying opinions among the group, but ultimately they were able to work together to get the water system flushed and sampled and return safe drinking water to the community. Everyone who participated in this team deserves a lot of credit for the achievements accomplished in what was often a difficult environment. And it did take quite some time, but the water was restored to safe drinking capability. So this is basically a summary of the IDW to ST's plan for recovery of the drinking water system. The system was divided up into 20 zones based on the mechanics and the flow of the water through the system. And first, the whole water distribution system was flushed with millions of gallons of water through granulated activated carbon filters. So they flushed the whole water system, and then each zone was heavily sampled to evaluate the water mains. Once the data returned showing that the water mains were okay and clean at a system level, then every single home, school, childcare facility, and commercial building in that zone was flushed. This included Navy personnel going to the home or building and flushing all the taps, including the outdoor taps, draining and flushing hot water heaters, dishwashers, etc. Then 10% of the homes and buildings in that zone, including all the schools and childcare facilities, were sampled. And just take a moment to appreciate A, the person power and time it took to make this happen, and also B, the amount of water. I'm a California kid, and every time I start thinking about the amount of water that was flushed through the system, it just makes my heart thud thinking about how much of that fresh water was flushed. But this was the attempt to clean out the system and then the sampling that occurred afterwards. One of the big holdups is that the sampling and the data, the analysis at the laboratories could only be done at certain labs on the mainland, and the transport of the samples took a fair bit of time. The results took a fair bit of time, and the amount of sampling that was done really overwhelmed the few labs that are EPA certified to do this type of TPH testing in drinking water. That was definitely a barrier. So the Hawaii Department of Health developed criteria for amending the health advisory in each zone, and a lot of effort went into developing the criteria. We required the IDWST to present the information demonstrating that all the criteria were met for a zone, and then the health advisory could be listed. So the IDWST needed to prove that all reported sources of contamination were isolated and contained. The public water system water quality data was compliant. There was no additional contamination occurring, and the water within the distribution system met all state and federal drinking water standards, and including parameters for TPH that were set for the incident. And then that was within the distribution system, but then also that those same criteria had to be met for water in the premise plumbing of each of the homes and buildings. So incident-specific parameters were reference levels that were developed specifically for this project when there were no maximum contaminant levels or MCLs available, such as for TPH. So this entire process, as I said, took a really long time. The laboratory analysis was a barrier, and it took until March 18th, 2022 to finally clear the final zone. This is a version of a map, of a highly publicized map we used to demonstrate when a zone was cleared or still under advisory. So in this version of the map, zones I1 and A1 are cleared in green and the rest remain under the health advisory in orange. So at the same time we were working to clean the drinking water system, we were trying to understand what the overall health impacts were. So we have this unprecedented event, thousands of people with short to medium term exposure to JP5 jet fuel in their drinking water without a historical or experimental models from which to base decision making. So how do we assess potential and current health impacts? So we sought technical assistance from CDC's ATSDR and NCEH, who helped us in many ways, including initiating an EPIAID, which is basically an epidemiologic deployment in the form of an assessment of chemical exposure or ACE investigation. So ATSDR and NCEH sent a team of 12 epidemic intelligence service officers to Hawaii in January of 2022, and they worked with us to create a survey and recruit participants to do a health impact survey. It was the largest ACE investigation to date with over 2,280 participants. And in the health impact survey, we asked questions about water use, health symptoms, medical care, effects on children, and pets. This slide shows the participation. We did, baseline is the January 2022 ACE investigation, and then we did a follow-up ACE investigation in September of 2022, which I'll explain about a little bit more as well. We had a large number of people submit surveys. However, even with that large number of people in the largest ACE investigation ever completed, it was still, we think, only about 14% of the households affected. And of that group, most, close to 90% were affiliated with the military. So our initial results from this study were published in an MMWR in May of 2022. And some of the key takeaways were that 87% of participants reported symptoms, with 80% of those reporting improvement in their symptoms when they switched to an alternative water source. 37% sought medical care. The most common individual symptoms were headaches, dry or itchy skin, and diarrhea, all of which were experienced by about half of the participants. Medical care was sought in doctor's offices, ERs, and urgent cares. And hundreds of people reported new mental health symptoms related to the event. And that really stood out as this event was very traumatic for people, and people were experiencing symptoms of anxiety, depression, stress, post-trauma syndromes, difficulty sleeping, and others. There were hundreds of symptoms reported in pets. Many children missed school due to health or logistics from being displaced. And we also learned that the majority of people received information from online sources. So there were plenty of limitations to a study like this, which I'll talk about in a little bit. I just want to tell you a little bit more about our evaluation. We also tried to combine information from other data sources to try to further understand the impacts. This included review of related cases from the Hawaii Poison Center and the Department of Health Syndromic Surveillance Program. We utilized DOH's at that point, very new syndromic surveillance program. And unfortunately, not all of the hospitals on Oahu where this occurred had been onboarded at the time of the event. And Tripler Army Medical Center, which is the main destination for affected persons affiliated with the military, is also not a participant in our syndromic surveillance program. So the data there is limited. But we were able to search emergency department visits from a number of other non-DoD hospitals on the island. And between that and the poison center calls, we can see some patterns here of when people were utilizing these resources. In addition, we were able to collect data on symptoms related from the emergency department visits and the poison control calls, and they really are similar to those reported in the health impact survey as described. It's also important to note that the timing of this event coincided with the start of the COVID Delta surge in Hawaii. So I think there is some concern that that may be confounding some of the results, as some of the symptoms are similar. In addition, many of the symptoms people experience after drinking the contaminated water can be somewhat general and may have been attributed to other problems rather than the water contamination. So there's a lot of confounding of the results there. So what about long-term health effects? Obviously, a very important question for people affected by this. And really the answer is they're unknown. Based on the toxicology of, petroleum hydrocarbons and the physiology, we can't really clearly predict or see obvious long-term health effects. But again, this is an unprecedented event and there's still many unknowns. So the Department of Defense, the Defense Health Agency, has established a roster of all its affected military personnel. And we have been working with them and CDC, ATSDR to try to move things into a full health registry, and also very importantly to include civilians affected by this event, as there was a significant civilian population living in housing that used to be military housing, but is now private and is served by the water system. And residents there did also experience contamination and symptoms. So one of the barriers to an effective health registry here is there's not a lot of information on individual exposure amounts, and that really hampers the impact of a registry, but we still think it would be useful at this time to follow people's health long term, which I'll explain more about the rationale behind that in a moment. There's also been some discussion of creating some animal experiments that would model this type of exposure. That would be limited information, but could also provide some useful parameters. So, really important to take a moment to talk about mental health. The event was an extreme source of stress. We really think the mental health symptoms related and sequelae are really likely to be persistent. And we had significant reports of mental health impacts in the health impact survey and complaints to the Department of Health, and observed in callers and on social media and in other areas. So, because we were continuing to get complaints from the community of people with ongoing health symptoms, we asked ETSDR to come back and do a follow-up health survey to see where people were. So that was done in September 2022. It was about 8 months after the first one. And what we found there, this was really intended to try to further understand the long-term health impacts. In this, we had almost 1,000 participants, 986, 61% were returning. So they also completed the first survey, and 90% were affiliated with the Department of Defense. And what we found is that a large number of people continued to have symptoms and health impacts that we can't clearly explain from a toxicology standpoint. So to be really clear, what we appreciate and value that people are experiencing real symptoms. We just haven't identified an evidence-based unifying explanation to account for the experiences. It's not what we anticipated initially, and therefore more needs to be done, which is why we feel a long-term health monitoring of this population is useful. So in the second survey, 80% of the participants reported symptoms in the prior 30 days, with 65% of those convinced that it was related to the water and the contaminated water event. People were still experiencing headaches, anxiety, dry, itchy skin, and fatigue. 85% were still using an alternative water source, despite the fact that the drinking water is clean and has been declared clean and safe for drinking. 50% of participants reported worse mental health, and there remained massive concern and frustration with communication, transparency, and trust. So I think this slide really kind of brings it home for me that, after the second ACE survey, we found that 55% of people reported worse physical health after the incident when compared to before, with 50% reporting worse mental health and 21% kept from their usual activities. That is really impactful, especially given 9 months out after the event. So these health impact studies, really had some limitations. They are convenience sampling, they're self-reported. We don't have any exposure data. We had some outreach barriers. And, I think the convenience sampling one is a big one. We only had, in the follow-up survey, we only had 1,000 people of an estimated 90,000 people impacted. So, this is clearly not a representative sample of the affected people, but at the same time, it does still reflect the fact that there are many people still having symptoms and still impacted. So it did have some strength. We had widespread partner engagement. We had a large number of responses for a survey of this type. And this really provided timely data for action. And that's really what I think the power of these ACE investigations were. And this is just a slide that shows some of the direct impacts of the ACE investigations and taking that data, particularly the data showing the large number of people still having health symptoms that they related to the water contamination has really helped move the needle on some follow-up services for people. So that is included the Defense Health Agency setting up a clinic in Hawaii for people having symptoms related to the water contamination called the Red Hill Clinic. It's limited to those that are military affiliated, but it's a start. The Military Health Services Interagency Work Group has restarted meetings and are meeting regularly. The Defense Health Agency shared some of its data around syndromic surveillance and other epidemiologic analyses they did on this topic. The Defense Health Agency has asked CDC for its own EpiAid for a chart review of all the medical records of people that sought care in the military health system. That's actually going on right now. It just started this week. There are plans in the works for a registry to occur. It is unclear at this point if the registry is going to be run by the Defense Health Agency or is going to be a third-party registry as recommended by the second ACE survey. And regardless, the registry, we have had commitment that the registry will include civilians. And there's been development of support for providers, including case conferences, working on some CME materials around this, and also the development of some telehealth toxicology consults, since there are no practicing medical toxicologists seeing outpatients here in Hawaii. So the ACE investigations and the data showing ongoing health symptoms has really helped push through some of these follow-up activities that I am hopeful are going to help further explain health impacts and help and support the families that have been affected by this. So what's next? The tracking of health effects in those ways I just described is undergoing, whether it will be a third-party registry similar to the Flint registry that was done in Flint, Michigan, or will be a Defense Health Agency registry is still under discussion, but the parties are all working together and hopefully the best possible quality outcome will be created. And, the Department of Health, we continue to do what we can to support people affected by the disaster, as well as healthcare providers and community groups who are supporting people. We're working with ATSDR on the initial activities around a public health assessment. They're looking at the potential historical and current public health impacts from the facility itself. Reviewing, water sampling data going back to 2005, health impacts, considering an exposure reenactment type of model, and really, sorry about that, really, trying to utilize every tool available to understand both what people were exposed to, how long they were exposed, and what kind of health impacts might be occurring or continue to occur. As far as the environmental steps, a lot of effort from the Department of Health is going on in these areas right now. The water is, the drinking water system continues to be monitored on a regular basis. The Navy is working on defueling the facility. The estimated date as of right now is June 2024, with everyone trying to speed it up. They have been able to remove the fuel from the pipelines. About 1 million gallons of fuel has been removed for the pipelines, and now the pipelines are undergoing repairs and enhancements. There are over 256 repairs to be made to make sure that the pipes can safely handle the defueling and really, be assured that there will be no further releases of fuel. Simultaneously working on a plan for closing the facility and working on recovery of the aquifer. So key point being that any further release of jet fuel from this facility is unacceptable, and this all needs to be done safely, but also as rapidly as possible, because while the fuel sits there over the aquifer is a risk. And I'd be remiss if I didn't mention the large public interest in this issue in Hawaii and the strong work done by many different community groups and individuals to further advocate for the health of Hawaii's environment and its people. Some pictures here of some of the advocacy groups working to shut down Red Hill. So some of the key lessons learned are listed here, as I've discussed. Clear and consistent communications, very important. The importance of this cannot be overstated. It's not easy to control, but misinformation and communication discrepancies really impaired this response. I recommend marshaling resources early, especially personnel. Identify the areas where you don't have personnel to meet the needs, and try to figure out ways to get those either from federal or other local partners, contracts, whatever you can do. Transparency and data sharing is, of course, very important, and really needs to be present. The public really needs it, even if it's hard to explain or the implications are not clear. And of course, remember the goal, eyes on the prize. Remind yourself and your team why you're doing this. Try to avoid getting caught up in the politics and the difficult relationships, and really focus on protecting human health and the environment. So that is the end of my presentation. My email is on here, and I'm happy to take any questions now that I'll do my best to answer. And also you can email me if you have questions as well.
Thank you so much, Dr. Felton. I'm going to get through as many of these as we can in the next 10 minutes or so. And yes, so if anybody else has any questions, please add them to the online Q&A box, and I will try to get back to them. Okay, and some of the questions you may have answered already, and if you have, you can just let me know that it was already answered earlier on. So the first question is, was there any rationale as to the increase of spills? This is, I think, right after the beginning when you had shared a timeline. Any rationale to the increase of spills after a lot of agencies assumed oversight of the actual site?
Oh, that's a great question. I suspect, I don't have a great answer, like an exact answer, but I suspect it's more awareness, because this facility really was like classified and confidential and not even really known about into the 90s. And I suspect there were a number of spills that weren't reported, that weren't announced. And I think that as the infrastructure aged, by the time the AOC was set in 2015, it was, the infrastructure was like 75 years old. So I think part of it was aging infrastructure, but I think probably there had been releases going on for a long time. And it was only when there was tighter regulatory oversight was the public and the government, the state government made aware of them, unfortunately.
Thank you. That was a great answer. We do have one comment that perhaps daily or continuous fuel reconciling may have discovered the problem sooner. And then a follow-up to that was, were any CDC or NIOSH HHEs performed at the site?
I'm not sure I know what a HHE is. Does someone want to put that in the chat?
Yeah, if you can add that in, I'll ask that again in a moment. Let's move on to the next question. Do you know by chance how many pregnant females or an approximation were potentially exposed during this event?
Yeah, that's a great question. So part of the follow-up survey was we were emphasizing participation from pregnant women who were pregnant or breastfeeding during the exposure window, and we really tried to focus on that to try to get some pregnancy outcome information. And we unfortunately only got, I can't remember the exact number. I think it was around 28 participants that had been pregnant. So the number was really too small to make any conclusions on pregnancy and birth outcomes. We think that the number that were pregnant during that time was probably higher than that. But at this point, really difficult to assess. There is some possibility that the current EPIAID that's been being done of the chart review of the military medical records might reveal more information on the numbers of pregnant people, but that's a big outstanding question.
Thank you. And so HHEs are actually health hazard evaluations by the CDC or NIOSH.
That was not done at the time.
Thank you. All right. Okay, next question. Did anyone reporting symptoms go to the base hospital?
Yes. So Triplet Army Medical Center is the big sort of tertiary medical center, and then there's a number of clinics on base as well. And there were, we think, around 1,000 visits to those different clinics and the hospital. In our initial survey, 17 people reported hospitalization, but the military hospital reported they had no overnight hospitalizations related. So a little bit of discrepancy in the data, and we've tried to reach out to people to get their medical records from the reported hospitalizations and have not been successful, unfortunately, in getting releases of information and medical record signed.
Got it. Thank you. I think that kind of goes in with another question further down about just trust and that part of it. So the next question, was the company that produced the fuel or the refinery able to produce any tox info?
No. And in fact, the Navy couldn't even still has not told us the exact makeup of the JP5 jet fuel that was in the facility. We were able to get a sample and we've sent it to a lab to get the full analysis. We're still waiting on the results. But all we could get was a general constituent makeup. And and same goes with additives. So there's likely 3 additives that were also in the fuel. Most additives are added at what they call point of action, meaning like right before it goes in the plane, like mission specific, they call it. But there was a de-icer, a fuel stabilizer, and one other additive that were likely in the fuel. But we didn't have that information early enough to test in the drinking water. And I suspect it was probably in low enough concentrations, and our overall concentrations of even fuel were low enough in the samples from people's taps that I doubt we would have been able to pick it up. But we have looked at some of the toxicology information for those chemicals in general, and there's not very much available. So that has definitely been a difficult part.
And there was a secondary question, which I know you can't answer, but I just wanted to ask it to add on to that. And that was how much N-hexane, which is a C6 aliphatic hydrocarbon, is there generally in JP5 fuel, if you know? And then at this site, was there the bulk spill drinking water or household air sampled for any N-hexane?
So no N-hexane in JP, or no significant amounts of N-hexane in JP5 that we are aware of according to all the different resources. So that's good. Air quality, air testing was a big area of discussion early on by a group from the Navy and the EPA and DOH. And because there was a lot of complaints of fumes and such. And there had been talk of doing some air sampling early on. And then it was determined that it would not be effective given that the water samples were showing such low concentration. So I think the air quality testing would have been useful in those first couple of days, but by the time the response had ramped up enough to do something like that, there just was no longer a significant contribution coming through. And there was concern about confounders from household products for some of the volatiles as well. So the work group on that elected not to proceed with air monitoring.
Thank you so much. Also, we do have a lot of questions, so if you want to stay on a little bit longer, we can, and also just let me know whenever you're ready.
Okay, I have a few
So
more minutes, so no
we had a,
problem.
we had a few questions about Camp Lejeune. Do you
Yeah.
anticipate the same level of lawsuits as Camp Lejeune? Do you think there were any lessons learned from that, like that example that maybe could have been used here, or similar situations with regard to that?
Yeah, there's been a lot of discussion of Camp Lejeune. I think for significant parts of it, for especially for the families affected, there are definitely some parallels. These families as part of the military, it's more than just like where you live, right? It's your employer, it's your community, you know, there's a dependence both ways, for the military and the families on this organization, and they give so much to this organization. They move every 3 years, they uproot their kids, and then to have this contamination and to feel betrayed by that organization, that's a really powerful, traumatic thing. And I think those types of feelings are likely very similar to what happened at Camp Lejeune. I think that the toxicologic exposure at Camp Lejeune is very different. The chemicals are different, and the length of exposure is different. So if you lived at Camp Lejeune and were drinking that water during your deployment, whether it was 1 year or 3 years, you were exposed to those chemicals every day for years. And also, chemicals we know much more about, and at least on initial look are significantly more toxic. So PCE and TCE, more toxic, more carcinogenic than what we know of JP5. Of course, with that limitation that we don't know a ton, but what we can deduce from the toxicology and the physiology is that PCE and TCE are more toxic, and the exposure was longer. So the exact exposure window at Red Hill is a little unknown. There is some information or evidence that there may have been small amounts of contamination earlier than November of 2021, in the summer of 2021, after that May 6th spill. There may have been some JP5 in the drinking water, certainly not enough to be particularly noticeable by people as far as smells and odors, but there may have been some. But before that, there's no evidence that there was ever jet fuel in the drinking water before the summer of 2021. So at max, the exposure for people, if they stopped drinking the water, according to the advisory, was a few months. And that's just a really different toxicologic picture than Camp Lejeune, which was many years for people and more toxic chemicals. Plus, we're also removed by a larger number of years there. So a lot of the health outcomes, may be exhibiting themselves. So hard to compare from that standpoint, but I think from the kind of the mental health and the trauma and the betrayal kind of standpoint, I think there's really some parallels. There have been lawsuits filed on behalf of, there's some class action lawsuits in this case as well. So I suspect some of that will be similar. And then it will, of course, be up to the Defense Health Agency and the VA and such if they are going to qualify this contamination for benefits and such. But that is definitely outside of my area of expertise.
Thank you so much. And I just wanted to add, there's a couple questions with regard to the components in JP5 jet fuel. And one person said, given the data gaps in tox info, you may consider submitting a nomination to the NTP for JP5 jet fuel. And someone else said, benzene, a minor component in jet fuel, is water soluble and can induce leukemia. Are there any plans to follow leukemia incidences in the exposed population?
Yeah, I think that will be part of the registry, certainly. Again, we were unable to detect any benzene in any of the water samples, either from the Red Hill shaft when there were like inches of free product on top of the water, and in the tap samples. So no benzene was detected. So we think the amount of benzene in the contaminated water was very small, if present at all. And we're hoping to further answer some of that question with some of these further studies. In addition, if you drink water with benzene in it for a few days, which is what we think most people were exposed to, is that likely to increase your risk of leukemia. I'm not sure that's been completely sussed out, but it would have been a short exposure. So I think the risk, from those assessments, I think the risk of increased cancer and leukemia, especially benzene related, are pretty low from this exposure, but that would definitely be something that would be high on the priority list, that both benzene or leukemias and other kinds of cancers would be something that the long-term health registry will definitely be monitoring. Great
Thank
question.
you. Yeah, thank you so much. And we do have quite a few other questions. What I can do, if you want to go ahead and wrap it up today, is what I can do is send maybe a list of these questions out, and we can send out some responses as we have them available with the rest of the email.
Great.
But yeah,
Sounds
thank
good.
you so much for being here today. We're so grateful to have you. And I know this was a really great discussion. I'm sorry we couldn't get to all the questions, but I'll definitely try to get them answered as we can. And if you want to put up the slide that you had with your email address, and you guys are more than welcome to also reach out specifically to Dr. Felton as needed.
Thank you so much for having me, and thanks for everyone for these great questions and your participation and interest. We really appreciate it.
Thanks. All right. Have a great day, everyone.